someone.
Hey, welcome to another episode of Maude Bless America. Couldn't be happier than to be here, of course, with Slegs, the faithful, but more importantly, Dr. Robert Vande Guchte, Canada's gift to the United States and Canada's gift to the world when it comes to spinal and trauma surgery.
Wow.
Not to mention, before we get started, Roberto, you are a well-known aesthete. So with that, a little toast, boys. Glad to be together.
Could you explain that word?
I can't even spell it, much less explain it.
What did he say?
An aesthete.
An aesthete.
So let's just have a little tasting, boys.
Okay.
What do we have?
Cheers. Well, that's for you to say. That's part of the deal. Let's test Roberto's aesthetism.
Okay, there's that word again.
Oh, that's very nice, Matt. You break out the good stuff for the docs.
Well, again, he's an aesthete.
Yeah.
Damn it.
You like that, Rob?
That is tasty. That is
let's list off one.
Well, so here's the first question. Now, on the tasting, is it New World or Old World, boys?
It's Old World.
Okay, that's a false. Let's have a redo.
Okay.
It's New World.
I thought it'd be for sure Old World.
So here we go. Now, would we say this is domestic or is this foreign?
I'm saying domestic.
That would be a good call. So we're narrowing it down. We're New World, domestic, United States,
Bravo.
excluding Canada. Although it could have been.
Right?
Well, Slegs answered. He's U.S.
Yeah. So what region? I think it's going to be West.
Well, that's a good call.
Okay.
So not Boston.
There's not a lot. Yeah, it ain't Niagara.
It is not Niagara. So with that, we've got West. That's a good call.
Now we're going to have to either go to the north, like Columbia Valley, or we're going to have to go down into the multiple valleys of California.
Well, which would it be? Take a sniff before you answer, David.
Napa?
You're welcome.
Is it Napa or Sonoma?
I wonder if it's neither. I wonder if it's Willamette.
It's not Willamette.
Oh.
Oh my God, the tension's building.
Yes, it is. This is
Maude Bless America. This is the first wine tasting we've done.
Yes, it is.
Oh.
It is. And blind.
Yes.
We've tasted plenty of wine. Don't say that. He's holding it in his hand.
I'm not going to look.
Okay, good.
Try not
You
to.
guys are the wine guys. I just drink it.
Oh, for fuck's
like
sake,
it.
Slegs.
Yeah.
Well,
I like it.
you do
Good.
drink it.
I do drink it. I like
free.
it. I'm
I'm going to stick around that. It's probably California.
Good call.
Okay. Sonoma.
No. Next one over.
Okay. So we are then in the, not Russian, we are the other way.
Napa.
The Napa.
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 Well,
This isn't a skip stone, is it?
Yeah.
It's not actually.
It's
But
really
that's
good.
a good guess.
It's really good.
Okay. Is it one that you just actually had a box of that you were showing us?
Why, yes, it was. Little Bond, boys. One of my favorites, the Kayala Vineyard. It's lovely, in my humble opinion. 2014. You can nod.
Really good.
Nice wine.
Very nice.
Thank you.
A good
Mateo.
celebration. For
Cheers.
Roberto being
No,
here.
thank you.
So now we're back to cheers.
There's an
Roberto.
interesting
God damn
story
it.
from a bond.
Cheers.
Okay, let's
And
get on
the
to
first time
questioning
I
our
ever
guest.
had a bond was with you and Kristen, and we were downstairs in
The oven.
the oven.
That got
With
weird.
the three of us, and we did get weird on it
Mm.
because you went through at least 2 bottles of it, and you kept on, and then you wanted to go to Phelps after that.
We did.
And
We
we're
had
just
a
like,
bottle of Insignia.
Wow, we were
living high on the hog.
Well, yes, it's like we had money to burn,
And
we did.
And you did, and you do.
Well, we did then.
Well, spine
Sure.
surgeons are well known for their money burning capability.
Yes, they are. Well, Rob,
Yes.
tell us. I'm gonna unwind all the way back to where did you go to medical school?
That would be up in Canada.
Okay.
So I was born and raised in the Edmonton area of Alberta, and started all my university right there. So
Okay.
I went through my undergrad there.
Undergrad medical school there.
Yeah.
Where'd you do
Wait,
your
wait, wait,
residency?
wait. Let's back up just
Okay.
a moment.
Yeah.
Okay.
Now,
so-
was it at the University of
Got to get
Edmonton?
close to the mic.
When
No.
you were on the
University-
hockey team that you were known as the Slasher?
that was actually before that already.
Oh,
You
So
gotta
the
get
University of
closer to the
Alberta.
mic. I know that.
University
Talk into
of
the mic,
Alberta.
goddamn.
Sorry. Is this?
there you go.
That's
Okay,
good.
Sorry. University of Alberta was an an attempt to try and make that. I was already had a little bit of a reputation of being even before med school, which is how somehow I got it after the fact. But
Wait.
What
What?
what
yeah.
reputation did you
What
have?
reputation? Now, are we at
I
University of
was known
Edmonton or
as the-
University of Alberta?
Rob? Were you
University
the
of Alberta.
enforcer?
There is no University of Edmonton.
Okay, so you went to the University of Alberta where you played hockey, but before joining the University of Alberta hockey team, what do we call them? The Oilers?
Well,
The Drillers.
is this
So to
the
speak.
this is the professional team is the Edmonton Oilers.
Right.
The
But we're
university
talking
team is
Alberta.
the Golden Bears.
The
The Golden Bears.
Okay.
The Golden.
So
Bears.
what was your reputation? The bit of a reputation
Yes,
you mentioned. What
well,
was that?
Oh, and by the way,
This
let's
was-
switch gears briefly.
Yeah.
Boys,
Switching
we're in.
gears.
Gosh, dang,
Okay.
Monday, school night.
School night.
Maud Bless
Be
America.
nice.
Bless
Yes.
Cocktail glasses.
Sledge,
Okay.
bring it on in.
I
Okay,
do like
now wait.
glasses. Very nice.
You clink your drink, Rob.
Yeah, I know. I'm not stopping.
Lovely.
What
That
is
is
that?
nice.
Well, that's a little Memphis toddy for you, Sleggs.
That's really.
I'm having
Yes.
scotch.
Yeah,
pretty
I
good.
get the same as you. The
All
guests apparently have to drink
Yeah.
the same thing. Yes. So no, actually, that little bit of a
Reputation.
reputation for having a little tiny bit of a hothead on the ice actually came.
Roberto.
I know. It's surprising, right?
I've never seen you have.
I've
the
never
temp-
seen you
I've
blow up on
Never
the
seen
golf
you
course
blow
or
up.
anything?
Well,
Anyway.
because I probably blew it off so many times there that I no longer feel it necessary to do it anymore. But yeah, I had a little bit of a reputation of not exactly liking the enforcement that was being provided by the referees. I prefer to kind of do my own enforcement, and they apparently didn't like that. So,
you
I
were
had a
a
reputation for a little bit of a hothead on the ice.
Did you play all 4 years?
I did not. So what happened was I played in college for 2 years, leading up to the university, and then went to play. And this was in my third year of university, playing for the Golden Bears at the time, and I wasn't able to make the team in the first couple of 3 lines. And I thought, well, do I want to be a fourth line guy? Maybe, or a sitter on the bench, maybe, or do I have to start at this point in my life thinking this is not going to be an NHL career?
Yeah.
It's going to have to be something else. And so that was pretty much the conclusion of. So I played 2 years in
what
college.
happened? What happened for the leading up to? So you played freshman, sophomore, and then your junior year is when we had the
Right,
revelation.
right, the revelation.
And what were you, a defenseman or a wing?
I was actually I played both defense and wing. I literally was trying out for both areas, mostly wing at the time, just size wise,
Gotcha.
But I did play defense in college.
Okay.
Do you still skate?
Not very well.
But you
I
just
still-
not like
I
you
still
used
do.
to.
No,
you can.
I still, and I up until about 8 years ago, I was actually still
Oh, you
playing
did?
here in Lincoln. Yeah.
Okay.
So
Did you play at Breslow?
played at the ice rink at the ice box because we had our kind of adult leagues that were there, and I think
What didn't Kleiner play in that? And,
he did.
And Ersty
and
and-
my last game ever was a game that both Ersty and Kleiner were there.
Oh boy.
And they will laugh at the story because they'll go, yeah, that was the game where he lost a blade, landed on his right side, broke 2 ribs, and he never played another game again.
Oh, Rob.
So-
That's a
and
way,
that was the
that's a way to
end.
put it into it.
And that was the end of the
hockey
doctor.
career.
And that was, and the,
So 8 years ago, you were well
Yes.
well
You were
into your
57
50s.
years
50.
old.
You were well into your 50s.
yes. Yeah. I
So
was,
that's old to be skating. I'm just saying.
yeah.
I'm just thinking that anything that athletic, that explosive, that's pretty old, and good for you.
It's good for the hips.
Well, it's a lot of fun playing, and it was more just fun playing with a lot of guys who
Yeah.
still think they can play hockey, but it's
Did
the
you
variety of
slash any of
ages.
them?
Oh yeah,
Oh yeah,
absolutely.
love it.
And that's why I got the reputation amongst, and it was Ersty that actually somehow gave me the Dr. Death
Dr.
Death.
Death.
Yes.
You heard it
Whoa,
here
you
first,
heard it
folks.
here first.
Dr.
Wow.
Death.
Dr.
Happy
Death.
birthday about that.
Straight from the Slapshot movie.
Straight.
I was going to say, that was out of Slapshot,
So
right?
Slapshot.
Dr.
So you were one of the
Death.
Hanson brothers.
Yes.
Yeah.
Well,
there
actually,
were three of them,
I
weren't
think-
there?
I think the McCracken was the
Dr. Death.
Dr.
Yeah,
Death.
he wasn't the Hanson.
And he was on the other team.
Yeah, they
Right.
went after him.
They went after him. That's right.
Wow, that's impressive.
Paul
so
Newman.
how many? So all of this athletic career that lasted till you're 57 years old, you're still an active guy. How many joint replacements have you had?
Only one.
That's it.
I only have
So
the one
far.
right now.
Fairly
So far.
amazing.
So far.
So far.
But there'll be more to come.
There'll
won't
be
there?
more.
Oh yeah.
I've had my share of injuries, and unfortunately, a couple of them have been related to initial hockey injuries. So
Sure.
Oh,
my
really?
one shoulder was an initial dislocation playing hockey in college, so, but it was kind of a string of different things that have gradually, and all because of certain different sports. Skiing has not been the kindest to me either.
Right.
So,
Yeah, you're still an avid.
but I'm still doing
skier.
that one. Yes.
Yeah. You and Matt both are avid skiers. I retired 6 years ago.
Yeah, but you don't have to.
You
can come out of
I
retirement.
chose to.
Yeah,
I
but
chose
you
to
can
go
come
on
out of
top.
retirement.
I chose to go on top.
You can
I
come
could come
out
out
of
of retirement.
We good.
I skied for 45 years.
Well, what's a few more?
Yeah, what's a few
Between
more,
first-
right?
There's no reason.
No, there's no reason
at
to
all.
stop.
It's like a bike.
It
Get
is
right
good.
back onto it.
I have no doubt that I
Right.
could ski
You just
hill.
got to figure
I
out the color coding a little bit.
I just don't want to fall and break ribs and
Oh, for
bust
shoulders.
shoulders.
Stay away from those blacks.
Yeah,
Those
yeah,
blacks
yeah.
will hurt you.
Yeah, the
Don't be
blacks will
racist,
hurt
you
me. Yeah,
guys.
no blacks
I'm just,
for Dave.
I'm just, I mentioned that because there was a joke that came out from, and it was actually by one of the sportscasters who
Yeah, I can't remember what it
Hilarious.
was, but it was
Yes.
hilarious.
it was talking about the various different ski slopes of Colorado,
Oh,
and that's how it all came out.
so you went to college and
so college at University of Alberta.
Yep.
Mm-hmm.
We got through undergrad, and then you said, I'm going to go to med school.
I gotta come up with something in my life, and so
Now, this was just you, or did your dad, also a prominent physician in Edmonton, said, Robert, what are you going to do?
Never
you can't
actually
be Dr. Death forever.
Right. And you probably wouldn't want to do that and go into medicine. So he said, if you want to drop that moniker, no, my father actually never put that kind of pressure on me. Even though as the oldest son, obviously that was I think in the back of his mind would have been a very fitting and satisfying thing for him to have me do. And so I think deep down, he really hoped that I would move into that direction. And in a sense, he was even kind of hoping I would fulfill something he had not been able to do. He always wanted to become a surgeon. And just with, unfortunately, people like myself and my brother coming into the landscape when he had the time to be able to do it, he was never able to go that route because
Had to make a living.
well, my mother and they had immigrated on their wedding as a part of the honeymoon, had come to Canada
From?
from the Netherlands,
Oh.
and trying to make a start here, not being able to actually work in the first couple of years because they had to redo some of the training.
Oh, boy.
By the time I was born, my dad had finally just started a practice. So he had friends of his who went into general surgery, orthopedic surgery, and he always wanted to do, especially orthopedic surgery, and just never did. But, he always would mention that. And so in the back of my mind, I always knew that, it was a field or at least a career choice that I would feel comfortable doing, wanted to do. And so it probably had a little bit of that family push. And so in the end,
So you
hope
answered the call.
made him proud. Yes.
Well, of course you have.
So, yeah.
So you go to med school, and then how is it on a comparative basis to the U.S.? You do your residency for
Yeah.
3 years in internal medicine. Well, you would have done orthopedic surgery and then fellowship in spine, or
Well, yeah. So it at that time, so this was back in the late 80s, early 90s, our
dark ages?
Medical
'Cause you're an old fucker.
yeah, thank you.
Thank you for
We're all
that.
that old, are we?
Well, no.
No. Okay, sorry.
you and I are.
We're all in
Right.
our 60s.
Matt,
I'm 60. I'll be
yeah,
61.
until Friday.
There we
Yeah.
go.
Yeah.
That's right. It's coming.
Yes, it is. Thank
So,
God.
Yeah.
No kidding. Cheers to birthdays.
There we
Cheers
go.
to
Cheers to
birthdays.
birthdays.
That's right.
Cheers to having another
Cheers.
birthday.
Yeah, and living to see it.
No kidding.
All right. So, Roberto,
Mhm.
you graduate from med school.
So med school there was 4 years. And then in those days, we all had to do a rotating internship. And you could decide at that point whether you wanted to go into a surgical kind of career or specialty, or you were trying to stay in more what was the family medicine program. So
Okay.
there was 2 more years for the family med guys, and then 4 to 5 more years, depending on which one you went to for the specialty. So after my rotating internship, which was kind of a, at that time, we don't do those anymore here. They go straight now into the specialties, either the family med programs or the orthopedic or surgery, any kind of medicine program. But it was a fun year. It was a year that you just literally
You saw
got out of med school. You did everything, but you were the resident in the house,
Got it.
which, there's lots of books written about what it's like to be, those house officer, house residents. And those books are somewhat true. There's a lot of interesting experiences that you do there that you learn late at night, how to handle things on your own because your
No one's
attendings
there.
they're asleep. They don't want to be bothered. So, but after that, yeah, I went into my 4 years of orthopedics, chose to do a sports medicine fellowship, did that in Calgary. So everything was in Edmonton, University of Alberta first, then went to Calgary, did some trauma fellowship component, and then went to Vancouver and did another year of spine fellowship. So
tell us about the Canadian medical system compared to the American medical system.
interesting, probably going to lead into something here. So the system itself probably is no different. I mean, the training is identical, the
I'm talking about the delivery of care.
Yeah, so that's where
And
things
the payment of
obviously
care.
change. Well, now we're getting into a deeper question here. You're right. I mean, and it is inevitably what kind of pushed me away from being in Canada, because I finished my fellowship training and I actually had a practice in Vancouver.
Oh, you did?
I did. Yeah, I had a short practice in Edmonton, kind of as I was moonlighting through my residency. And I was fortunate enough to work with a sports medicine guy who, interestingly enough, was a former hockey player.
Oh, boy.
He was one of the Edmonton Oilers for many years. Tall guy, Randy Gregg. He played in Japan for a while and then finished his medical school.
Played hockey in Japan?
Played hockey in Japan?
Played hockey in Japan.
I
Yes.
didn't know they had
Yes,
hockey
Randy.
in Japan.
We learned something new.
He
Yeah.
played for the Kokudo
And the
Bunnies,
viewing
of
audience.
all things.
The what?
Kokudo Bunnies.
Kakudo
Kokudo bunnies?
That's what the Kokudo is.
That sounds like a strip club. I'm sorry.
Well, I don't know if
Well, maybe it is.
Rob,
we.
you know
Well,
that it was a hockey team?
I've seen
Do
pictures.
you know
But
what
I
the
don't
strip
know. It
club
might
is
have been
like?
a front. All I know is
Kokudo Bunnies.
Yes. So I had a short practice with Randy, and actually I much enjoy. He's a super nice guy, and he still has a practice in because after he finished playing professionally for the Oilers, he went to do this full time as a sports medicine specialist. So that was my first foray into the medical system of payment, which was very interesting because it doesn't pay like it does here.
Meaning a
You're
doctor
leaving money
doesn't
on the table.
can't get paid like they do here.
Well, yeah, because we're being paid in Canada with basically a government managed healthcare,
Right.
which is strictly that the entire, I guess, payment is being pushed through a single payer
Yes.
situation.
System.
Which is
Right.
what our 3 presidents ago wanted, a single payer.
Right.
President Obama.
Right. And we do have technically
Biden.
here, because we have a VA system that technically is a single payer
The
system.
VA system.
Right.
Yes.
And if you ask any vet what it's like to be in it, it's interesting. It's reasonable quality, care when you get it,
When you can get it.
but it's when you get it.
Yeah.
It's,
Is it regulated by the number of providers? Is it regulated? Is it means? Is it age? When you say when you can get it, what does that mean?
It's rationed.
It's not so much. Yeah, I mean, ration might be an over. So what happens when you have a system that has X amount of dollars that are being allocated to a healthcare system? So
Okay.
all of that money has to come in basically through taxes.
Right.
So the taxes come into the Canadian government. They determine then of all the tax money we have, we can allocate.
It's like the defense budget. They
Right.
have a health budget.
Right. And so we have a very strong, military budget here in America that occupies a very large percentage of our tax dollar.
Mm-hmm.
In Canada, we don't have a very big military. I mean, we've got 2 boats, and I think there's at least.
You got the Canadian mounted police.
So you got
we
the
got
RCMP.
Those, yeah, we got those red-hatted guys.
Kind of begs the question, though: who'd want Canada? No, I'm not.
Oh, come on now! For our viewing audience, that was not a slight. Can we say that's not a slight? For
it's
the viewing
not a
audience?
slight. I have Canadian relatives. Nobody wants them.
Okay.
Well, I think.
Yes.
I mean, it's obviously Trump wants Canada. He just wants it for himself.
No.
So
he
he-
wants it for the look.
And
Canada
all of
has
Profound
natural
resources.
resources. Any
Absolutely.
country.
By the way, and
Yeah.
that brings up the question. So, what's the story? Because Alberta just got all of the petitions and then some to get onto a ballot to secede from the country of Canada, be a standalone province.
Right, which is
Did your folks sign that?
Is it Mark Carney?
My point-
Mark Carney is the
Mark is the prime minister now, right?
Mark is the prime minister
Of-
yeah,
of-
of Canada.
Canada. Canada.
Yeah.
Mark Carney.
Yeah.
Say, of Canada?
Yeah.
Yeah.
But then there's
There's a premier
the premier
of Alberta,
who's
right.
the governor. For
He wants
Kind
to
of-
secede.
We call-
he,
yeah,
he
we
wants
call
to
him the premier.
secede.
He
but
wants to, which
they
is
got
the
a
second
giant-
time that has been attempted in Canada.
But it was Quebec the
Quebec
last time, right?
previously did this, and that lent itself to a significant
Defeat.
And a very violent, issue that happened in Canada.
Yep.
Because that led to a lot of angst amongst the English and French, which occupy Quebec. I mean, everything outside of Montreal is French. Everything inside of Montreal is 50-50, but that's a big city.
It is
So
a big
you
city.
have, and it's the largest city in Quebec, and
How big?
4 million,
Okay.
How big is Canada in general? What's the entire population?
33 million.
So not not
One-third.
a densely populated
A
country.
lot
given
of
its physical
geography.
size.
Right. Physical
And-
size is larger than the United States.
Unbelievable natural resources.
Yes.
Unbelievable. And beauty.
Yeah.
And beauty. Yes,
Right.
you're right. And the reason why Trump wants them is strategic and the natural resources.
Absolutely. By the
Yes.
way,
51st
if Canada's for sale, I would like to put together a group to buy it.
Would you?
Yes, I would.
Okay, would you?
Well,
I think the natural
just saying.
resource alone, I think
Well, yeah.
you should
Well,
do
the
that.
Canadian
Matt.
dollar is pretty low, so I think we might be able to swing that.
Well,
Get
Is it
enough
exchange?
people?
Is it
say get
exchange?
enough people.
I'm going to Canada on Friday.
I think we're going to
Well, you're going to
crowdfund.
love it. It's like
I'm going to Canada on Friday.
it's
What are you doing in
I'm
Canada?
going fishing. What do you do in Canada? You fish. I'm not drilling for oil.
Well, you could
I could,
It's-
but
well, it's
I'm
opening day.
fishing.
It's gonna
bring
be a
it
little
back
brisk.
because
It
we
will
need-
be fresh, but it's supposed to be 60.
Oh, well, that'll be
That'll be beautiful.
Where are you going?
I'm going with Rainy
Oh,
Lake.
that's right.
Up with
Rainy.
DP3.
Right.
Yeah.
Yes.
Yeah.
I've heard lots about his little place up there.
So what do we
It's not
think?
so little
What do
and-
we
No,
think
yeah.
about Alberta seceding? I mean, it was not merely a majority; it was a huge majority of signatures
Yes.
above the required amount.
I just
And there's
it's
no
hard
French
to
over there.
imagine how it could happen, because it's you couldn't do it without the support of British Columbia and Alberta, because you just couldn't do it alone and stand as a country all by itself inside that. And no different than what happened when Quebec tried to do it, and then the Maritimes were stuck, kind of going like, well, what about us? Well, I guess we're going to go to United States. That was the talk. That the Maine area would just kind of take over. They already have half of New Brunswick anyway. How
As
that
well
ever
they
happened,
should.
it's hinterland up there.
They aren't
Not
going to
much.
secede, though, are they?
Well, it's going on to the ballot.
Yeah.
They're gonna,
Oh.
the citizens of Alberta are going to vote. Do they?
So
or
it'll
don't
be
they
its own
secede?
province?
Its own
Well,
country.
Its own country.
Country.
Technically, it would
Well,
be its
Trump
own
will want
country.
that then.
Well, I mean, Alberta's natural resources,
Right.
the wealth of that province
Yes.
is staggering. And
Right.
the big argument is they're sick of all their money leaving Alberta, going to
Supporting.
the liberal
Right.
coast,
Yes.
and
Yes.
frankly, the liberal government
Right.
that Canada's had for years.
Right. Which
Now,
is
Trudeau was by far the worst.
Well, he's dating
On-
Katy Perry.
Which one? The old
Katy-
one or the young
The
one?
young one.
The young
the older
one.
one
Is he
was
dating
actually.
Katy Perry? Is that right? Is that his girlfriend?
Hey, Maud Bless America does not address gossip issues.
It's not gossip. I think
It's
it's.
gossip.
I think it's published. I don't think it's gossip. Gossip would mean you can't find it anywhere. I think we can find it a lot of places.
Still might be awesome.
Okay.
You know.
All right.
We'd call that the smut pages then.
Are
We,
you,
we don't address smut.
Rob? Are you dual citizenship?
I am.
You
Yes. Yes. I've retained my.
What does that look like when you're born in Canada and
Right.
you're a citizen in Canada and you reside in
When he
the
needs
United
health
States,
care, he
Rob?
can go to Canada because he did pay taxes into the system and get free health care
Can you?
if he can get it.
Technically, I mean, I would have to actually gain some residency in Canada to be able to do that because
There's a bunch of Vande Guchtes that live in Edmonton.
there's Edmonton and British Columbia. You're right. I could kind of, but it
You
technically
could
speaking,
poach.
just like here, in order. Well, here it's a little different because we have a much more of an insurance managed. That you can just buy insurance. But if I were to be wanting to have Medicare, I would have to at least show that I have residency here in the United States in order to qualify for American Medicare. No different than in Canada. For me to qualify for Canadian healthcare, I would have to show residency, and ideally it would be 6 months plus 1 day because it would have to mean my majority
So
residency.
in Matt's new adoptive hometown of Indian Wells, California, there's a lot of Canadians out there,
Mhm.
and they are very, very careful to spend less than 6 months and 1 day in the United States.
Correct.
In
Absolutely,
Indian Wells or any of the Coachella Valley, and
absolutely.
they are absolute about that.
Okay, I
Yeah,
know that
they
they'll
Well,
watch the calendar.
They
Yeah, but-
watch the
but
calendar.
the funny side is that whole the whole Coachella Valley, all the Canadians are pissed off that Trump
They
was
were
going to
a
take
lot
it over.
of homes.
They've
for
sold a
sale.
lot of
They
homes,
did.
and
They did.
They'll come back eventually.
They
but It's
will.
going to be a while. They got their feathers ruffled.
They did. So, what did you still have family in Canada?
All my family.
Okay,
I-
so
I'm
what
the
did they?
only one that-
What did they?
that-
What did they say? All that stuff Trump was
Oh,
doing
gosh.
when he wanted to buy Canada or make
Well,
it the 51st
Take it over,
state.
make it the 51st state.
Yeah, I mean, obviously,
Saber rattling, I call it.
it ranged from one of my family members who is outraged every time she even hears the word Trump, or the fact that I'm even discussing anything
That you
the
even
United
mentioned
States.
the
Even
name
mention
Trump.
the word.
Right.
She has actually decided that ever since Trump has been in, she has never stepped foot into the United States again.
But you were happy about that, right?
Well, I was kind of
So
happy because
when
she's not my most
okay.
favorite.
So if when Trump,
Mhm.
he's not going to run for the third time. So in 2028, when he's not president, so will she come back?
Well, that
Well-
depends whether she's invited. And Rob just said she isn't
Well,
invited.
she's at free will. She can cross the border. She has
She
a
can.
passport. How do
She
you,
can.
do you have passports? You have passports?
Yes.
Yeah.
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 So yeah, it's because I mean she is by far the most extreme on that side of anti-Trump, and yes,
and she's married to which one?
and to Michael. And Michael is the interesting thing is, so he actually makes his living going to the United States. I know it's
So
And
she
I-
refuses, but her husband.
right. Her husband regularly goes up to Alaska, to Anchorage, because that's where his Canadian business does business.
Okay.
I'm going like, Sue, that doesn't seem correct that you could say, I am not allowing Michael or myself to come into
But
the United
Alaska's the
States,
United States.
but I'm going to let my
It's just not
husband
the,
go up there and make money.
it's just
off
not
of
the
the
lower
American-
48. So what is his business?
He's geology.
I'm sorry.
So he's in the
Geology.
resource business.
Oh,
Yeah.
he's drilling. Drill, baby, drill.
Well, not oil, but he is drilling.
And not
too.
Sue
Yes.
when he's going to the States.
Well, Sue won't drill him because
no,
he's going to the United States, and she
Yeah.
forbid it.
it's
I forbid it,
I couldn't.
Matt.
believe it
I
when-
forbid you going to the United States.
Damn
would-
it.
She wouldn't even, allow him to. Okay, I'm going to spend about 10 hours going over the border just to cross to a golf resort and then come back. She goes, "No, you're not doing that." I'm just going like,
But wait
you're
a minute.
allowing him 3 to
Michael,
4
You're
weeks. at
telling
a
me
time.
he goes
up to Anchorage
frequently.
3 to 4 weeks at a time. Like it's not.
Maybe he's
like
trying to get
running
away
in
from
and out
Sue.
there.
So does
He only
she
needs to
not
be there
think
for a
Alaska
day, but
is
he's
part of
staying-
the United States, or
Well,
Not
it used to
the
be,
lower
well, we
48?
bought it from Canada. Actually, we bought it from
We bu-
Russia, but
we
it's
did buy
attached
it
to Canada.
Yes.
Yeah.
We bought it
But
from
We know the
So-
Russians are going sideways and the Canadians are going
Yeah.
sideways,
you
trying
can
to
see
get our
Russia
oil,
from
Roy.
Alaska.
So that, yes, you can. So that's the extreme of one. And then I have my sister and my brother-in-law who are the opposite. They're
Now that's
very
Simone.
much.
And what's
Simone
your brother-in-law's
and
name?
Carl. They're
Carl.
very much, yes.
Carl, the
What's
truth.
Carl's last name?
Peters,
Carl Peters.
but not related.
Not
Or
Nathan
friendly-
JP
JP.
or nervous
I thought,
banker.
didn't you call him Carl Weathers? he's very large. And
Rocky.
yeah.
He
He's
is
a big
he is
boxer.
He is a pretty good size, but he doesn't have the same colorage as our good friend Carl.
Okay.
So,
Okay.
but no, they love coming to the United States, and actually they have a place just down the street from.
I was going to say when
Palm
you
Springs.
when you came out there a few
Yes.
years ago, you said it was your sister.
My sister.
Your
So she
sister.
has a place in Palm Springs area. Just her.
Why don't you come visit her and come visit us?
I should have. They're actually down there right now. I just got pictures from my other brother and Carl that they were playing a golf course called Manago
Mm.
up at Takuta Canyon,
Mm.
which is just west from Palm Springs,
west of Palm
up
Springs.
on the
Yeah.
highway.
This sounds like a strip joint deal.
No,
it's
it
kinda like
wasn't. I
that.
looked
That's
at
the
it.
something bunny deal.
I-
Cuda
I
Hoot
looked
Bunny.
at it.
Cuda Coo bunny.
It's a casino.
Cute bunny.
It's like the cuckoo.
Oh,
yeah.
it's on the north side of the
It's the
interstate.
north, yes.
Yeah.
Yeah.
Um,
There's two golf courses there, beautiful looking golf.
And a strip
that's where
bar.
she lives.
No, they have a place in Palm Springs, just south of the airport area.
Okay.
Yeah.
All right.
South of the airport.
Yeah.
So in Old Palm Springs.
In Old Palm.
Matt stayed out
Okay.
there he had a RDBO
January.
out there, right?
Yep.
January. Yeah.
Had a lot of
Nice
fun.
area. Nice
area.
area.
Great
town.
restaurants.
Yeah. Great restaurants.
Perfect for you, Rob.
So,
I know-
KKY is the radio
Rob,
station.
I've kept on looking at the gallery, and I know that there's
why don't you? So
well, you
I know-
cut quite a swath at
So
the wine
at-
festival in Palm
at your
Springs.
young age, how long are you going to be a surgeon?
so I'm 65, just turned, and
Young.
but
A young
you know,
65.
right, young 65, and I had planned to try and look at maybe retiring in Halloween of 2027 for numerous
That's
reasons.
next year.
Halloween.
Why Halloween?
Well, because
It's a frightening holiday.
It's a great holiday.
Hold
There's
your hand,
multiple
hold your
reasons,
hand
yes.
up one time. Okay.
Yeah.
Thank you. We'll come
Thanks.
back to that. So
Okay.
now Halloween, what?
So Halloween, so October
Hands of a
31st
surgeon.
of 2027 would mean that I've been here in practice with the Lincoln
Your
and
partners.
/ Nebraska Orthopedic Group for 30 years to the day. I
Wow.
started November.
So this is like
1.
the end of World War One. November 11th at 11 a.m. They ended the 11-11-11. You're
Right.
doing 30 days
Is that
on the
armistice?
31st.
30 years.
30
I-
years to
yep,
the day.
30 years to the
Versailles.
day. I started November 1 of 1997. So I thought, well, that's a fitting, number. The group is looking, that timing between 65 and 68 is kind of our, okay, you got to make a decision because you're not going past 68. So that was kind of on part of it. Plus, I rarely work the first 2 weeks of November. I am routinely always in Mexico,
Ah.
have been for years. And so I'm going like, well, I'm going to go away anyway, November 1 for 2 weeks, maybe more. So what's the use of coming back?
So
Love
So
it.
there.
So you're
Tell
giving
us-
them plenty of
yeah.
time to phase into you retiring.
and they have to find a
Now, do they have a
And
replacement spine guy?
That's the
You,
issue
they're having
right now.
problems, are they
We're
not?
having little problems, yes. So
Yeah.
we had somebody that was an Omaha resident who was very interested. He already has a couple of my present young partners who were his residents up at the UNMC. So they were really trying to work on him coming here, but it's significant others will sometimes squash any idea.
So we're back to Sue. You can't go to the States,
Right.
even though that's how you
And
make
her-
a living.
His
Or in this case, you can go to
Tyler's,
Lincoln.
yes, in this case, Tyler's wife said, no, you can't really go to Lincoln.
Lincoln,
because I want
Nebraska.
to be in Omaha.
Oh, boy.
So tell us the circumstances on October 31st, 1997, that you came to Nebraska.
So let's go back. So you had a little practice. You were moonlighting in
Mhm.
Edmonton.
No, I was.
But you were
I
also
was,
in Vancouver.
actually moonlighting was back in basically the early 90s there. I started my practice basically in 95, 96, and had that practice in Vancouver. I was living downtown Vancouver, was
Cutting a big swath.
Yes.
Yes.
We'll
Why-
get back
why-
to
why-
that.
Now
swath.
that you mention it,
Now that we mention it, why, yes, it was a big swath.
and nobody can either confirm nor deny that he wasn't
Right.
cutting.
Well,
a
and
big
even if
swath.
they can,
It's
we
in
have
Canada,
a statute of
stays up in
limitations.
Canada, so it's more than
Thank
25
God.
years at this point. So.
Yes.
But no, so I the practice that I had there was actually a really good practice. It was with one of the larger hospital organizations there. It was just a bit of a commute every time. But the biggest issue for me was, again, the healthcare system limiting
You were
time.
undercompensated.
Yeah, well, compensated was okay. For what I was doing, I thought I was actually getting paid reasonably well, until you start looking at what you're getting paid here, and you're going like, okay, now I wasn't reasonably well paid.
Right.
But for Canadian levels, I was actually being paid quite well. But the problem was the utilization of time to operate, which as a surgeon is what you want. You want to be able to have time to put your patients in. And your question earlier was, is that a rationed thing? Well, it's not
they
really
ration the time on the
but they
surgery
ration-
table.
Well, they ration how much time they can offer for surgeries to be done, because we've only got so much in the budget to do X amount
This
of
is
surgeries.
crazy.
Well, so everybody's heard about the waiting list that has happened there, where a total hip replacement is 8 months.
So everybody comes to the United States to get.
Yeah. And they pay
Don't
cash.
They can, if they can, they will.
Say if they can afford it.
Right.
If they
come
can
here.
afford, they
Right.
come.
And it sounds like there's a lot of people. There's actually provinces that have actually made contracts with those upper, states like North Dakota, Minnesota,
hmm
where they've created a contract with the hospital,
Oh,
so that
Really?
like the Manitoba government has a contract with a couple of different hospital systems in both Fargo and in Minot to actually say, we need you to help kind of diminish our waiting list for our total knees and total hips. And so they allot so many people to go down just so that they can, because it doesn't matter if you knock that down, there's another person that's going to be on the list. So
right.
Wow.
there's more than enough for the Canadian doctors to do their procedures and be able to do it within a budget time frame up in the Manitoba area for that matter
rationed
anyway.
health care. Now, is that just for elective surgeries? Is that for everything? Acute care, emergency care?
No, just for elective.
elective. Okay.
Elective.
All right.
So
Yes.
this is a dumb question.
Yeah.
And I
There's no
freely,
such thing
I
as a dumb
freely
question.
embrace being dumb.
Okay.
But as a civilian,
Mhm.
I'm sitting there saying, for example, you had to have your hip replaced. You
Yeah.
could barely move.
Yeah.
Right.
Why would we call a hip replacement a known therapy for a physically debilitating
Mm.
issue,
Quality of life.
keeping you out of being a productive surgeon? Why would we call that elective? That's absurd to me.
Yeah.
It's kind of like saying, yeah, you know what? You need open heart surgery. It's elective. You can keep living
Right.
for a while until we have to
Till the
resuscitate
valve
you.
Fails.
Right.
Valve. Yeah. I mean,
Right.
it's just,
It's a great question, because obviously what it's built on is the various different, I guess, vital signs that are determined important and not important. And there was a time, and this is about 20 years ago, where in addition to heart rate and all that, pain was considered one of the vitals.
would make
And
sense.
so the government actually stated that no, pain needed to be managed as just like a vital. And so suddenly the whole medication problem came on board.
Oh.
oh,
To
Oxy-
mask the
Oxycontin.
pain.
to mask the pain.
technically we
We don't call it.
we don't
masking
call
the
it
pain.
mask, because technically
Is it
when
treating the pain?
you are, because but you're treating,
Mm.
you're actually managing the pain,
Okay.
because technically you're not treating the underlying reason why the pain is there.
Right. I need a new
So
freaking hip.
medications
So we're
do
creating
not-
a generation of addicts
well,
by
that was the
failing
problem.
to treat the
we
underlying.
we
issue.
probably initiated that problem, and
We
so
meaning
we, the doctors, helped the system at that time, because it was a mandated approach to
in Canada.
healthcare.
So
in
the
the United States.
So the system actually mandated to the doctors,
right.
You got to get on board, Roy.
You got to get on board. You got to help.
So
you got to realize that pain is.
So then we end up suing the makers of the drug and
and
paying billions out.
We flipped the switch, about 10 years later when we realized that
we created addicts.
We created a big problem here, and so suddenly, pain was no longer considered one of the vitals that had to be treated and managed.
So isn't this a compelling case to say keep the government out of the fucking healthcare delivery system? I mean, it's just example after example, and yet we have all these people saying, "Oh no, single payer is just wonderful," like it is until you need it,
exactly,
or your loved one.
I've asked several of our doctor friends. Are you familiar with a doctor named Peter Attia? He is a longevity expert, and he prescribes something called medicine 2.0 and 3.0, meaning you just described how American medicine works, where I have a pain, we're going to give me a pill or shot to treat that pain, manage that pain. His goes back further and talks about how to one of it is prevention to the extent of lifestyle, as opposed to medicine. And lifestyle, and it could be as simple as diet and the things that evolve with that. So it's kind of interesting. I read his book, and he thinks that our system's completely broke with regards to how we manage all of our symptoms in our country, whether it be diabetes, whether it be heart disease, whether it be obesity, all of those things. And he wants to go back to somewhat behavioral, as opposed to managing the symptom itself.
Right.
What do you think about that?
I think it's the right approach. I mean, obviously trying to determine where the problem started, where did the conditions start, and so things like diabetes, we realize, of course, there is a bit of a genetic component, but there's a huge environmental reason that people have diabetes. There's obesity is probably one of our biggest concerns.
I think it's
it's probably the number one health problem that we have, because it actually leads into so many other health problems that are out there that are secondary to it. Our pulmonary problems, our cardiology problems, our endocrinology problems, our musculoskeletal based problems have a significant effect from obesity.
So have you ever had
lifestyle?
Have you ever had to tell a patient we can't do this procedure that would give you a relief from pain because you're too freaking fat?
I don't know if
we had one of your partners on here.
He probably had some implications.
We had one of your partners on here who said, yes, I have had multiple patients I've had to say.
He didn't put it that they calling him too freaking fat.
No, he said, we can't do your procedure because you're a little too heavy on the hoof.
I mean, it can be put as plainly as that. I think that there's
some
probably
there's
a better way of describing it, in that you could probably
this procedure would be better if you weren't so heavy.
Right. Well, the outcome of the procedure would be much more predictable should you have
less fat fucker.
Habit. Okay, we'll go right to that part.
Yeah.
But that's the truth.
Is that where we're going? We're going right there.
We're just shortening it down.
Yeah, I don't think I've ever actually looked at a patient, and because they're so significantly overweight, that I go, I just physically, there's no way I could do it. I'll say that with a little bit of a grain of question, because there are certain procedures that I would consider not necessarily life or limb threatening issues that I'm going, like, to try and do this would be a significant undertaking, which I don't feel is worthwhile doing. Now,
oh boy,
for the
effect and for the potential complications.
So the cost benefit doesn't make sense. So on that subject, hang on, Sleggs.
Mm-hmm.
So Robert, as a spine surgeon,
mm-hmm.
even though it's a long part of the body, it's relatively tiny and refined and minuscule work that you're doing. Is that correct?
That's correct.
You got big man hands.
Hold your hand. Like, how the hell are you doing that?
How are you doing that with it? I mean, those man hands.
Thank God you're not a proctologist.
You look like Jerry Seinfeld, man hands.
He's got the man hands. So with that,
two fingers of whiskey.
You do cases that are, they're how long are they? mean, 10, 12, 15-hour cases, and you're having a guy put to sleep, doing all the stuff, and then you're rolling the body over so that you get access to get into the spine to do your actual work. So you've got another surgeon doing the prep on the body carcass before you even get a chance to do your deal. So again, we're back to it. You have profound risks from being under anesthesia for too long.
Correct.
Those are compounded by obesity.
Correct.
So here we go. We're right back to this whole thing. Not to mention, should you make a mistake, we have America's hidden tax, the plaintiff's bar, waiting for you to make a perceived error, even if it may or may not be an actual error. It's the human body.
Right. So that's why a lot of times, the question of obesity is more a high risk surgery.
Yeah, exactly.
And the potential complications that can occur that you can predictably identify as being magnified over top of a person that isn't. So you can, kind of have that discussion with the patient. And then the other thing is the actual predictable result, which is a lot of times where the discussion of, is a total knee or total hip replacement a really good idea in a person whose BMI is so heavy that even that implant is going to have trouble surviving.
Wow.
And that's where, the decision amongst a lot of the joint surgeons is saying, well, no, I cannot do that procedure because technically it's elective. We go back to that discussion of, what is considered elective and what is not. Technically pain, which was being addressed as a required treatment and now no longer is, it's become a relative determination of treatment. And so if you say, well, I know that your pain level is limiting you from being a productive person of society, but it's not a neurological concern. It's not a tumor concern. It's not an infection concern. It's not a life-threatening or a limb-threatening problem. It's a functional problem that and so suddenly pain as a determination for surgery becomes elective, even though you're right. The benefits to society of getting a person to replace their hip or replace their knee and getting back to a functional lifestyle and a functional working lifestyle is hugely beneficial.
Absolutely.
And that's one of the reasons that the Canadian system has tried to look at how are they going to decrease this, because in their budget, they only have so many total knees they can do that year and so many total hips because they only have X amount of dollars and they can only spend it on, so many of those procedures. And if you have only so many
we're not in the Canadian system because that sounds like a
Rob, I got to ask you a question. Let's just take all the surgeries you have.
Wait a minute,
I got a drink.
Okay, sorry,
So
you clink, you drink, and that is a fundamental rule of Maude Bless America.
Let's break down in three simple areas.
Yeah.
Genetic, environmental, meaning I'm an athlete or I'm a bricklayer or I'm a laborer.
Or I'm a Canadian.
and I will call lifestyle. If I see a lifestyle, bad lifestyle, my environment, meaning I choose the work I do, I work with my body, or it's genetic. So those are the three simplistic areas.
The pillars.
Yeah, where are most of your surgeries lie? What bucket do they fall?
Take trauma out of it. Let's do
take trauma out of it. Take trauma out of it.
Because those are accidental issues.
Yeah, trauma is a car wrecks.
Well, of the three that you listed, genetic is way, way at the bottom.
Okay. Well, we're all built
it's pretty rare that we have to deal with a genetically, related type of condition.
Isn't that
especially
a GMO, a genetically modified organism?
In the adult
GMO
life. Yeah. I mean, in the more pediatric style, we see a little bit more of that in the spine because scoliosis is probably the biggest one that has a genetic component. There is no kind of environmental or lifestyle thing that causes that. So the pediatric world has a lot more genetically driven treatments that we have to do.
That makes sense.
In all areas.
That way.
Got it.
But once you've gone to adulthood, then technically it's unlikely that there's going to be a genetic, and we do see, some of the conditions that unfortunately do come in more later into lifestyle or life as, the ALS, the
Sure.
Parkinson's,
Yes.
which, you know, but those are fairly, you know, small percentages of what we have to deal with. We much more deal with, I would say, lifestyle in the age of 20 to 60. And then after 60, it's probably more long-term environmental,
Okay.
you know, so that it's just simply a factor of, you know, what you were doing and your
Wear and tear.
the wear and tear.
You were what were you called? Dr. Death and
Dr.
hockey,
Death,
right?
the slasher.
You're friggin' flying down
He was
black.
Jack the
Canada,
Ripper of Edmonton.
Right? That is
for shit's
environmental.
sakes, on the
right?
ice rink.
Those are
Yeah.
your choices.
No, I know.
Yeah. Huh.
So-
That's interesting.
It's fascinating. So let's switch gears.
Okay.
Not only are you Canada's gift to the world and to the state,
Not to just the United States,
But-
to the world.
to the world,
Okay.
but now let's narrow it down.
Okay.
Canada's gift to golf.
Yeah.
Because Robert, you were
Oh,
quite a
yeah.
golfer.
Ah.
Well, I
How did
think
you
of
develop
myself.
golf?
I have golf on the brain.
Even when
Are
you were
you-
a kid growing
Are
up?
you obsessed with golf?
You know what? I do think I am. You know,
Would you
I
give
think
up skiing?
honestly,
Describe
which one-
obsessive to
which
me.
one?
it means I
skiing
would
or
never
golf?
want to give that up. I would
So
never.
you'd give
I
up
would
skiing
give up.
before you'd give up golf?
Yes, I
You would what? What'd
I
you
would.
say?
I
What'd you
know.
say, Matt? What do you give up?
I
what?
asked if he would give up skiing over golf, and he just said he would.
Well,
Yeah.
that's not your
It's-
answer, is it?
No, I'd give up golf in a heartbeat. Can I be done playing golf just so I can ski?
After the
I'm
last
not that
two-
good of a skier,
after the
but
last
after
two
my
games
golf
I've
Don't they have
been
country
to,
clubs for
I
skiers?
wouldn't disagree with your.
I
choice
don't
on
blame. Exactly my point. You know, the wheels didn't come off. I was getting belly dragged. There were no wheels. I'm so bad.
that. He has a better chance of becoming a very good skier.
Sadly, that's truth.
But you're a very good skier anyway.
Not as good as Robert, but I have a better opportunity at that than golf.
Yeah, I mean, I was fortunate enough, of course, that outside the fact that I probably, you know, almost had a set of skates coming out of me, you know, from the womb. I also had a set of skis coming out, you know, because in Canada you have to do one or both
Hockey or skiing?
or both. Yes. So
So-
luckily in my family, it was you had to learn, you had to do both.
So where did this golf?
Fetish.
Well, that didn't come from my parents.
Right. So where did
So,
that come
yeah,
from?
that was, you know, a post high school kind of summer, I guess,
Summer was 3
experience,
months, right?
3 to 4 months.
Yeah.
Yeah. And so, you know, that's where my, I happened to work in a job that was a 3 to 12, you know, kind of job.
What was the job? Why were we being so cryptic? What did you
Well,
do,
because
Robert?
This
This time?
okay. I worked in a wholesaler, I guess, like a delivery system. So it was for groceries and all that. So
So you were.
Was it Dutch
you were
owned?
I was a shipper.
distributor.
I was a shipper. Yeah.
What was it? Dutch owned?
No, Horn and Pitfield was, it was actually American owned, believe it or not.
Was it
Yes.
for grocery stores or for food service?
Both,
Okay.
but especially for grocery stores. So we were the IGA, the Independent Grocer Association.
Okay, sure.
Provide, I guess, wholesale.
How'd you get
transport.
that job?